everybody who's joined us from across Scotland. Denise said we've had a fair number of questions, and we've because there were quite a lot on particular themes, we've grouped those together in some cases. So if there were 3 or 4 questions on a particular topic, we put them together. So hopefully we will manage to convey the spirit of your question, even if some of the letter of individual questions has been merged where there's 2 or 3 together. But other than that, we'll come back at the end to where we'll go with next steps with anything that comes in during the session or that's raised for you by the discussion and by the Minister's comments. So if I can kick off, I'll read to you the first question, Maree, which is to do with the difference between formal kinship care and informal kinship care. And this is one of the ones where there was quite a range of questions that were asked. So the question was, why are informal kinship carers treated completely differently to formal kinship carers? For instance, many informal kinship carers get no support, no financial help, even if they've given up their jobs. We know of families who provided care for children where the alternative would have been to go into foster care, but because the child wasn't placed by social work, because the family prevented that, they're considered not eligible for an allowance. Why is this?
So thanks, Robin, for your question. The first thing I want to say is thank you to the Kinship Care Alliance for Kinship Care Advice Service for organising and delivering this fantastic programme. And, you know, I think it's absolutely fabulous that we have a week celebrating kinship care. We all know how important it is for ensuring excellent outcomes for children and young people. And the week provides an opportunity to raise awareness outside the community of what kinship care is and to celebrate that difference that you're making to children and young people. The role of kinship carers is fundamental and it is absolutely vital. I firmly believe that the best place for a child to live if they can't live with their birth parents is within the wider family and within their own community, when it's safe and in their best interests. And that's what kinship carers do. They enable that to happen, which is so vitally important for children. Now, the difference between formal care and informal care is based upon the legal status of that child or young person. And a local authority has statutory duties. So those are legal duties that they can't ignore to any child who is looked after as a result, if the placement's made as a result of social workers' intervention, it has to be formal and it has to adhere to the 2009 Looked After Children regulations. I would say it's vital for all children and young people and their carers, both in formal and informal care, to have the support that they need from the local authorities. And local authorities agree that it's important. I personally am determined to improve the life chances of every child who's in care. So for me, it doesn't make a difference, the formal, informal status. It does make a difference what the law says. And we're looking very closely at whether that is working on the ground. So you'll hear a lot today as we talk about, you know, some of the questions and things that you're going to put to me. I'm sure you'll hear me say several times, we think we've got quite a good suite of policy. We've certainly got some good legislation in place, but sometimes what happens on the ground doesn't match our aspirations. And we're pretty keen to close that gap, very keen. And you'll have seen a whole lot of work go on in this area. So things like the promise, so the independent root and branch care review. We asked for that review because we know that things aren't working on the ground in every case. And from that review came a suite of recommendations February last year, which became the promise. And we've signed up to the promise, Scottish Government and all local authorities. So that is one way that we have, you know, made a commitment that we are definitely going to improve things. We want every child to have safe, fulfilling and secure childhoods, and we want to make sure that we are able to offer support to families. Now, one of the challenges is that not all families want that support, and some families get the support that they need. So it's the ensuring that people know the support is available can access it easily, but don't feel it as an invasion into their family life. And we are striving to get that balance right and to get it better.
Good. Thank you, Maree. I suspect we may come back to that issue, because that issue of formal versus informal and the kind of slightly grey area in between, or not necessarily slightly grey area, the grey area in between causes a considerable amount of anxiety and is a regular issue that's kind of raised through.
And it does right across the board. So it's not just kinship carers that causes an issue too. And if you look at, you know, what the promise looked at, and I don't really like the phrase, but the edges of care is a really important one. So how do we support families in a holistic way that prevents them from landing up in crisis so that the state needs to intervene? And that should apply right across the board. You know, I'm Minister for Children and Young People. We talked, before we were live on air, we talked about today's a momentous day in the Scottish Parliament. We're incorporating UNCRC into Scots law. And one of the aims of that is that families, when they need support, they have a right to support from the state. And we don't want families to have to be warriors and fight for that support. We want it to be just automatic, that it's there, that safety net's there. It's easier to say than to do, but we are determined.
And I'm sure everyone does know UNCRC, United Nations Convention on the Rights of the Child, which has been talked about for a long, long time. So it's pretty momentous day, actually, that that's going to be incorporated into Scottish law. Thank you, Maree. Can I move on to the next question, which was to do, and this is another one that comes up constantly, it's to do with variations across the country. And there's a couple of separate questions here. And so these questions are about variations in support across Scotland. So the first one is, why is the level of financial support different in each local authority, including allowances, means testing, and reimbursing costs for expenses such as furniture and clothes? We should all be equal.
So I agree, although the way the legislation and everything is set up in Scotland, it is for local authorities to decide. They've got autonomy over their finances, and therefore the allowance and the financial support that each area sets is set independently by the local authority. And local authorities are you know, a facet of local democracy. So they're elected by local people and priorities are set by local people. That's the plus side of it. So you're talking to somebody who comes from the Highlands and Islands. We're quite passionate about local democracy because we recognise that what works in Edinburgh isn't necessarily going to work in Achiltebui. You know, those remote and rural challenges might well bring variation to what a child's needs are. You know, travel expenses, for example, likely to be greater in my part of the world. The challenge, though, is that, I mean, I find the variation almost indefensible. So, you know, if I look at Highland compared to Argyll and Bute, very similar challenges, very similar terrain, sparse population, and there's a big variation. When we drill down, the actual amount of money in families' hands doesn't vary that much. It's just the way that it's delivered. So I think a bit more standardization and a bit, you know, removing of bureaucracy, making it simpler for families to get what they are entitled to. I mean, these are not, you know, this is a family's right to have that financial support, I think would be a good thing. And of course, we had the National Review of Care Allowances, which reported in 2018. They made 12 recommendations. Recommendation 3 in particular suggested that a Scottish recommended allowance would achieve consistency for children and young people in foster and kinship care, and that allowance would be designed to cover 16 core items of expenditure: food, furniture, clothes, hobbies, activities, family trips, all of that. And we are absolutely committed to delivering on those recommendations. We're working alongside COSLA and other key stakeholders to consider how we can implement those recommendations and introduce a standardised allowance. But the pandemic intervened, and I know, I mean, it's infuriating. It is absolutely infuriating. But if you remember this time last year, the whole world had to turn and face a crisis. People from my portfolio had to go and work in health because it required so many extra people to put in place the systems for test and protect, and looking after people who had to be shielding and things like that. So unfortunately, that piece of work had to be put to one side during the course of the pandemic. We've picked it back up again and we're working on it, but I can't give you a guarantee when we're going to get a resolution. And I am frustrated that it's taking so long. But we are, I think working together to deliver on that, on those recommendations is absolutely the key to ensuring that all kinship children and young people have fair and equitable allowances in place for them.
The other question, I think, Maree, will kind of follow on from that as well. So I'll ask this one, and then it'll maybe cover a little bit of the ground you just covered. But there was this particular person mentioned the specific local authority that we're in, and we haven't actually included the name of the local authority. We're very happy through Kinship Care to take up specific issues if there are specific issues about your local authority, and that we can do anything in terms of oiling the wheels, in terms of making links work more effectively. But just in terms of this context, we just made it a general point. So the point was, it's my firm belief and experience that our local authority have a reprehensible history of supporting kinship carers. We feel like the poor relations of the adoption, foster and kinship carers group often overlooked and uncatered for. Why is it down to each local authority to decide how exactly they support kinship carers? And the bit that kind of followed on from that were, are there any plans to create a national standard for kinship carers? And would these be the same for children who are looked after and who aren't looked after? So sorry, there's quite a lot of different bits in there.
Yeah, so the first thing to say is I would encourage any kinship family who feel that they need more support to speak directly to their local authority about their circumstances and concerns, and to seek advice from the Kinship Care Alliance Advice Service Helpline. I would also say, your local MSPs should be able to support you with this, and a number of MSPs come to me with concerns where they suspect that families are falling through the net, and together we work on ways to improve that. The Ombudsman is also a place to go to. So if you're struggling to get the service that you want from your local authority, going to the Ombudsman, and I know it feels, I hate it that people feel like they have to fight, I really do, but absolutely it's really important to persevere and to keep going until you get the level of support that you need. Local authorities are responsible for their own care and planning, and I've said that before, they have autonomy over how to support families in their area according to their need. We do know, though, that more needs to be done to support families right across Scotland, and we did commission the Independent Care Review, as I said, that published last year, and its findings include a focus on improving things for kinship care families. The First Minister has committed, the whole government right across the board, and all relevant stakeholders have also agreed to make the changes that are necessary, and we've begun that work. Again, the pandemic has intervened, but despite that, the promise is such a high priority for us. We have begun that work. So we've launched our £4 million Promise Partnership Fund to help organisations deliver changes to better support children and young people and families, and that includes both formal and informal kinship care arrangements. Over the winter 2019-20, so the winter just before the pandemic hit, my officials met with every single local authority in Scotland to understand and to discuss specific aspects of local kinship care service provision, and as well as meeting with kinship care service groups right across the country. So we wanted to get a better understanding of that variation, and we have a significantly better understanding of that variation. We, in our programme for government this year, committed to improving support for kinship families and to establishing a kinship care collaborative, which is going to drive that work forward, and that also has begun its work. So there are partners on that, including the Promise and Social Work Scotland. The collaborative considers what's needed in the way of support for families and practitioners, and also considers quite specific issues highlighted, including the assessment and eligibility for allowances, because we are well aware that that is an area that is being raised regularly with us. It's also vital that the collaborative represents the views of children and young peoples and kinship carers, so they're represented in that collaborative as well. And we're very keen that a representative from the Kinship Care Advice Service, new Kinship Care Advisory Group, will join the collaborative. And I would encourage anyone who's interested to get in touch with the service. It might sound, you know, sometimes I think people are already working, you know, kinship care families are already going above and beyond the calling of duty in looking after their families. And I know it's a big ask to get involved with something that the government's doing, but we don't want to, it really will work better if your voice is strong in that collaborative. And we want to hear absolutely. So I find when I'm working as a minister, one of the most important things is for me to understand what's happening on the ground and to hear from people exactly how it feels. So then we can think about new policies and new solutions, and we can stop and think, does that work for them? Will that solve that problem that was raised with us? Because often it's not just it's not just about persuading us that we need to do it, it's doing it in a way that works. And the collaborative, I think, is one of those really key means to make a difference on the ground. And already it's been, you know, we're very, very keen to hear what the concerns are from kinship carers and to get to work in solving them.
Thanks, Maree. There was a thing last night in England, 640 folk attending a webinar about developments in kinship care there, and the legal system's completely different and the context completely different, but it was really striking how that message about kinship care is feeling overlooked when people are thinking about the needs of children. And that, you know, the point people were constantly making was, irrespective of the legal route or the arrangements, the needs of the children are very, very similar, whether or not they're in foster care or adoption or kinship care or wherever it is, and it's holding on to that message.
Absolutely. And, you know, I can't emphasize enough just how important the job that kinship carers do is. You know, in terms from a child's perspective, absolutely the best thing is to stay within the family and to stay within their own community. It is, you know, vital to, you know, for the child's outcomes. So it is hard to hear that kinship carers feel overlooked. I absolutely recognise that that is the situation for many kinship carers, though. What we're trying to do is strike the balance so that people don't feel the intrusion of the state into their family life when they don't need it, but they know the state is there to support them. And that's a difficult balance to get, but I'm determined that we'll do it better than we have been. One of the things we thought about, and you know, I'll be very honest about this, I've been tempted over the years that I've been minister to consider taking allowances out of local authority control and put them into maybe Social Security Scotland or something. And you can see that that would give us a real advantage in terms of, you know, not having to gatekeep anymore, and you know, people will be able to apply, and at the core of Social Security Scotland is dignity, respect. You know, we could see real advantages to that. One of the disadvantages would be that local authorities wouldn't know who was accessing that financial support, and those families who might need support and other types of support. So sometimes it's not money that's required, sometimes it's bereavement counselling, sometimes it's access to early learning and childcare. So disconnecting the local authority from the families would probably be a harmful thing, and we just need to be, you know, I know it's frustrating, but we need to be very, very careful that we carefully craft a solution that delivers the best possible outcome for children. And what, you know, again, I mean, it is a momentous day today as we're incorporating UNCRC into Scots law. That makes UNCRC justiciable. So that means that, and I don't want this to happen, I don't want a rash of lawsuits to occur that force a difference in how we approach these situations. But we are very clear that what we're seeking with that legislative change is a cultural shift, a rights-based approach. Children have a right to support from the state. We all, you know, absolutely, and it will be a legal right 6 months from royal assent. So in just this year, it will be a legal right. And I think that will make a substantial difference.
You mentioned the promise UNCRC and the Kinship Collaborative. The specific point somebody had made there about are there any plans to create a national standards of kinship care? Is that where you see that would come from, that kind of drive to? So,
I mean, I'm not averse to the idea at all. And, you know, if that's what we think the solution is in order to make the difference on the ground, we certainly would consider that. That would be probably for the Kinship Care Collaborative to come to that conclusion. There are, you know, really good examples of national standards making a difference. Sometimes though, and certainly I've had examples come to me as cases where people have just literally, you know, clattered through the net. And it's incomprehensible how that has happened. So you think all the legislation and all the policy is in place. Why did that not happen? So sometimes it's not, you know, putting another layer of policy in isn't the solution. Sometimes it's changing the focus. And this is, again, you know, I hate to go on about the UNCRC, but again, that's what we're hoping from this piece of legislation today, is that when people are, you know, when the local authorities are presented with a child who requires their support, they don't have to battle for it. That's the difference we're looking for.
Good, thank you. Can we move on, because lots of other topics. So we've got a question or two about legal costs. Quite often kinship carers are thrown into a kind of legal process very suddenly by this, and that can incur costs. So the particular question was, what provision is the Scottish Government willing to make to support kinship carers in meeting the legal costs of securing children's permanent residence with them, including the costs of any subsequent legal challenge from birth parents?
So Part 13 of the Children and Young People Scotland Act back in 2014 places a duty on local authorities to make kinship payments to qualifying kinship carers caring for an eligible child once a kinship care order is in place. They also have to provide financial support towards the cost of a kinship care order being obtained. And an eligible child is a child who is at risk of becoming looked after or who was previously looked after. Now, the Scottish Government provided funding previously to support the costs of obtaining kinship care orders as part of a £10.1 million settlement to local authorities. But absolutely, I recognise that more can be done, and our officials are going to have further discussions on this matter. We're quite keen to progress it through the Kinship Care Collaborative, because we are hearing examples of where this isn't working on the ground. So we're pretty keen to solve that problem quick.
Thank you, Minister. The next one was a couple of separate questions about support from an employer towards somebody who becomes a kinship carer. Actually, it's one question, but the person told a wee bit of their own story. So one of the kinship carers told us she'd taken on the care of a 7- and 9-year-old at the start of July. She worked throughout the summer period, and she said her colleagues were flexible and supportive, but things came to a head in October, and the carer ended up taking time off for stress-related reasons relating to the placement. And that had to come from her carer's leave allowance. And so the question she was then asking on the back of that was, what support should a kinship carer reasonably expect from their employer when they become a kinship carer? And are there any plans to improve this provision across Scotland?
So policy on parental leave is reserved. So it is Westminster who are in charge of that aspect of employment law, not the Scottish Government. I firmly believe that kinship carers should be supported when they take on this role. I can't imagine, you know, I'm a mum of 3, and I can't imagine if I had become a mum of those 3 children overnight in the course of an emergency, usually associated with a traumatic event and really, you know, really difficult circumstances for the family member or, you know, extended family member who is taking the children on. So I absolutely understand this issue, and I absolutely agree that kinship carers should be given some sort of parental leave. I'm more than happy to write to my counterpart in Westminster and raise that issue. I think it's the Secretary of State for Work and Pensions who would be the person to write to, and I'm more than happy to raise that with them. I think it's absolutely right. Given, so it's not just the whole becoming a parent thing. It is also the job, you know, this is ensuring the success of kinship care arrangements is important to everyone, because it ensures the best possible outcome for the child, and it saves the state from getting involved. So making these kinship care arrangements work is vitally important. And one of the frustrations we have as politicians, you know, we realise this prevention, spending money on prevention is far more successful than spending money on solving the problems once things have gone wrong. You know, remember there was that big review in Scotland, the Christie review, that, you know, made the economic case as well as the moral and ethical case. So, you know, this would be one of the examples where I would say that would be money well spent, ensuring the success and ensuring, you know, that the children and the kinship carer have the time to cope with it's always traumatic circumstances that lead to a kinship arrangement being in place. So the time to heal from those traumatic circumstances, get themselves set up as a family, and then continue on and flourish. I think that's time and energy and money well spent early on. So happy to write.
Oh, very useful. I mean, I think a point that a lot of carers have made, unlike foster carers or adoptive parents who prepare for these events, kinship carers are often thrown into this extremely short notice and having to grapple with the implications for employment in the midst of that.
And I remember, I mean, I've met some kinship care families who I will never forget, frankly. And one of them was a young lassie who took, so an orphan who took on her brothers and sisters and became, at the ripe old age of, I think, 18 or 19, a parent to those younger brothers and sisters. And, you know, she talked about her mum going into hospital. And she said, I thought my mum was just going into hospital. I didn't know she was going to die. And just the impact of overnight becoming a parent to brothers and sisters in those dreadful circumstances. I'll never forget that conversation with that young woman. She was absolutely awesome. But I have to say, you know, it is powerful. The stories you tell me are absolutely, it's, you know, I'm not immune to them. On the day that we closed the schools, this time last year, when we had closed the schools, I was thinking of kinship care families that had met in Inverclyde just a few weeks earlier. And one of the grannies, that was a granny who had her 5 grandchildren, ranging from toddler up to a 15-year-old who was doing exams. And I just thought, how is she going to cope in a 3-bedroomed house? How is she going to cope with the schools closed? So your stories are really, really powerful. And that's why, again, if I can get you involved with the Kinship Care Collaborative, it is really important for us to hear these stories and to make sure that we make things work for you, because you're doing a vital job for us. And we absolutely know that it's the best thing for the children.
I think that might link quite well to the next question or two. We actually had a kind of raft of questions to do with trauma, and trauma is one of the themes of Kinship Week this year. So there have been some talks. There was one yesterday, and there's something to follow later in the week. Thinking about the impact of trauma on children, and then the impact on their carers. So this particular carer was saying, kinship carers need help in coping with the trauma that children can experience with their birth parents, as this lasts a lifetime for the children. Why is it so difficult to get the support our traumatized children need? And can carers also have the help and support they deserve to help them understand how to approach and cope with the effects children suffer?
So, I mean, this is a really excellent question, and it gets right to the nub of some of the most difficult challenges that kinship care families face. There has never been a more crucial time than now for all of us to gain an understanding of trauma, because in the midst of this pandemic, we've come together and we faced, a mortal threat collectively. We've had to stay apart. I mean, really, really difficult, challenging situation. But it's shone a light on some of the inequities that people face and some of the services that we need to rebuild to allow us all and enable us all to heal from the situation that we've been in. So I would say all of us have to use the experience that we've just had to build back a better future. And I know, again, that sounds pat, when I'm talking to the audience that I'm talking to, but it's really, really important that we reflect on what we've learned in the last year and build stronger services going forward. I think early on in the pandemic, one of the thoughts that crossed my mind was that instead of thinking about vulnerable families as being, other families, actually pretty much every family in the land felt vulnerable. And, I think it's really important for us to reflect on that and learn from that as well, that any family can be tipped into crisis at any time. I don't think it's possible to eliminate all trauma, and the last year has shown us that very clearly. We can't remove trauma from people's lives, but we do have a unique opportunity, I would say, to really aim for some transformational change in ways that we support families, in the way that we help families to rise and face some of the challenges that come their way, and help to keep families strong. Children live in families, families live in communities. So things that we can do to invest in keeping strength in those families, within those communities, is really, really important. One thing that we're really committed to is a trauma-informed approach and taking a trauma-informed lens to absolutely everything that we do. We all, if you think about, and I talk about it a lot when I'm talking about learning and education, we all need to feel safe in order to thrive. So if you think about Maslow's hierarchy of needs, we need to take care of those bottom layers before we can fulfill our potential. And it's just basic. We need to feel safe and happy and secure and well fed and warm, all of those things before we can thrive. We need to have choices, and we need to feel empowered. And we need to have children, particularly need somebody trusted to support them. So being trauma informed means that every interaction we have with someone who's been affected by trauma can make a difference in their recovery. Trauma informed services are those which first and foremost are designed and delivered in partnership with the people who they're for, so that we understand what they need, how we can reduce any barriers that exist, and crucially, how we can prevent adding harm. So if you think, one of the really important things about a trauma-informed approach is for people to feel empowered, and everyone listening to this will have experiences where they felt disempowered navigating the bureaucratic system that's in place, that they have to do this in order to access that, or go to this person and then go to that person before they can get that thing. So that feels really disempowering, and we're pretty determined to reduce that. One of the magical things that's happened during the pandemic is that we've had, for the children's hearing system, we've had a lot more virtual participation. And actually we have found that families feel a great deal more empowered when they're in their own home, rather than walking into the formal setting. I mean, we've made great efforts to make children's hearings less formal and more comfortable, but it's not quite the same as being in your own home. And those situations where there's a power imbalance, it's really important for us to understand that, and crucially to take steps to reduce it. So I think that the virtual hearings will be here to stay, where families want them and want to participate that way. And I'm hopeful that gives those families who are involved in children's hearings more power as they navigate that system. We're quite keen for trauma-informed services to be everywhere and just to be the norm, so that you don't have to go to, you know, a specific trauma-informed service to get what you need. You know, that literally everyone, every time you ask for help from the state, every time you interact with the state, you get a trauma-informed response. And we've got a national trauma training programme led by NHS Education for Scotland, NES. They've made a huge amount of progress in training workforces right across Scotland. So people are we've got, you know, trauma champions, we've got, they're embedded in local authorities, but you should start to notice a difference in you know, education and health. You know, pretty much everywhere that people go to for support, there should be that understanding of where people are and that ability to meet them. I must admit, I'm quite encouraged by this approach. I hear a lot of enthusiasm for it. I hear a lot of championing trauma-informed support, and I think I'm pretty sure that will continue to make progress, and that people will begin, if they haven't felt already a difference, they'll start to feel a real difference on that front. As a government, I mean, many people listening today will have heard of ACEs, Adverse Childhood Experiences, and some of the understanding that we've developed over the last few years about how adverse childhood experiences affect you right throughout your life. And although, like, our understanding isn't really new on that, but it's really helped us to focus and to bust some of the silos that exist, so that people understand that, you know, it's everyone's job to make sure that children do okay, and that every time families come into contact with the state, this is the kind of approach that they need.
That's very helpful. I think that bit about it's both individual and collective is helpful, because for an individual carer, they're struggling with a particular situation and need some help. How do I manage this particular situation? But also it's interesting you mentioned education, because there's a lot of discussion around the difficulties related to education, and if education, if schools are helped to take a more trauma-informed approach, that is a kind of collective way of addressing some of these issues and supporting the carers manage it without feeling they're totally on their own with that.
I know, and I mean, this is the magical thing. Some places are doing a brilliant job. Some schools are just fabulous. So I remember in the last, maybe a couple of years ago now, we'll just write off the last year. A couple of years ago, I went to visit a marvelous school in an Ayrshire mining village, and there was lots of trauma in that village. You know, it was a post-industrialized, sort of, that had all the problems that post-industrial Scotland has, and many of the children, you know, was quite high deprivation levels, and it had been considered a failing school. This headmistress came in, and she just was like, well, you know, I am not going to turn this school around without turning this community around, and it needed to be everybody's collective effort. And just as she showed me around the school, there was wonderful things, like the school had chickens, they had hens, and they collected the eggs from the hens and cooked them. And she talked about a couple of the pupils who couldn't regulate themselves well enough to be in the classroom, but they were able to regulate themselves well enough to care for the chickens. And one of the wee boys got the chickens home during the holidays, and he was just delighted with himself, you know, because he was able to care for these chickens. And you just think, this is the holistic trauma-informed approach that education needs to be taking absolutely everywhere. And they were going from strength to strength. They were going to go on and get bees, so they were going to have honey as well. But they also had lots of opportunities for the community to come in and be a part, so that, you know, it takes a village to raise a child. you know, I hate to think of kinship carers feeling alone and unsupported, and the school can be a real guiding light in bringing the community together and ensuring that there is support around individual families. But yeah, there was some wonderful work going on there. I mean, the children were learning to massage each other as well. I mean, talk about nurture. Everything they did was nurturing each other and nurturing these animals, and it was just wonderful to see. And of course, by taking that approach, the children were flourishing. And you know, the academic performance had turned around completely from a failing school to wonderful things happening. But that's because those immediate needs were being met.
So there was a specific question in relation to education and tutoring schemes, actually. Can maybe follow on to that one? So it says tutoring schemes were being introduced in England for kinship carers. Could kinship children in this country have access to this? As during the lockdown, many kinship children did not have access to education hubs, some through preferring not to attend due to risks associated with this, and others not being offered a place. A Scottish tutoring scheme would impact on educational attainment for kinship children.
Yeah. So firstly, I'm pretty hopeful that the second lockdown was a better experience for kinship care families in terms of being able to access educational support and attend their normal. So one of the reasons that we chose to make it that people went to their normal place of education, so they just went to their usual nursery or their usual school, was to make it easier for vulnerable families to be able to access that support, because we know during the first lockdown it was largely working families who were able to access the educational hubs, so the key worker families were more able to access the support than families like kinship families. There are tutoring and mentoring services available already that support kinship children in Scotland. Some of them have been in place prior to the pandemic. There's a brilliant homework club organised by a group of kinship carers in Glasgow. I'm pretty sure I visited that one in Ivan McKee's constituency, and they just do the most amazing work. So older children supporting younger children and playing and doing, you know, games. And that was in partnership with a voluntary organisation. Some of these tutoring services are supported by local authority attainment funding for vulnerable children. So some of them are financially supported deliberately during the pandemic. So almost, you know, all face-to-face operations have stopped, and these organisations have been, most of those organisations who were doing face-to-face work have transferred onto online work. Now, in terms of post-pandemic, hopefully one day we're going to be post-pandemic, we're pretty keen not to take a blanket approach to increasing children's learning time or the intensity of their learning time, but to make sure that extra support's available where it's needed. Schools and local authorities should be able to target support where it's needed most, and that will include tutoring as an option. So there's initiative, sort of eSchool initiative or eSchool initiative, which started on the Western Isles. That's now being available right across the country. So that's, you know, access to certain lessons online, and interactive services will be available online as well. My own feeling is that there's a great deal, I don't like the focus on learning loss. I think that almost disempowers parents and carers who've been doing the most amazing job during the course of the pandemic. Children have missed out on face-to-face teaching, but they haven't missed out on learning, and they will have been learning a great deal. The other thing I'm very, very clear on is that we have the entire population has had a traumatic experience, and we need to heal from that trauma. So there might be lost learning, but there's also been lost social time with our friends. There's been lost experiences in terms of, you know, going to museums and, you know, just socializing with a wider circle. playing. I mean, the price our very youngest children have paid in terms of the reduced opportunities to play, which is absolutely vital. You know, for very young children, play and learning is the same thing. And I just think we need to be careful about thinking, you know, entirely about tutoring, you know, extra maths and English, and need to think a little bit more carefully about creative approaches, including youth work, after school clubs, you know, all these brilliant, talented, creative people. Sport is another really important thing that children have missed out on. And I just want to make sure that there are plenty of opportunities for children to access all of the things that they missed out on during the pandemic, and to help them to heal from the experience, rather than just focusing on the book learning.
There were a couple of specific COVID-related questions, actually, Minister, so maybe they follow on from that very nicely. So the first one was why Kinship Care is not prioritised for the COVID-19 vaccine, and can this be changed?
So in Scotland, we are following very carefully the JCVI recommendations, and that is because they are kind of charged, they're experts, health experts in vaccination, and they're charged with working out how we can use the vaccine to the greatest effect during the pandemic. And of course, at the moment, we're still working through the first tranche of JCVI recommendations. So by mid-April, we'll have vaccinated everyone who's over 50, and all of those categories, including people who are at particular risk. And that will, focusing on that group first, will take out a great deal of the mortality and morbidity from this pandemic. So focusing, if you think about where we started in care homes for the elderly. You only have to vaccinate 20 people in an elderly care home to save one life. And the supply is limited. We don't have a limitless supply of vaccine at the moment. So using it where it's needed most is the ethical thing to do. And if we took vaccine out of, these categories that are higher risk, to give it to the general population, even though kinship carers are absolutely vital, we would be taking vaccine, that limited supply of vaccine, away from people who really need it, and giving it to people who need it less and where it will make a less of a difference. When we get on to the second tranche, so under 50, so a lot of kinship carers will have qualified already. A lot of people will be in that over 50 category and will be called very, very soon. And we're making enormous progress in terms of our speed of vaccination. So there were some days there when the supply was good, where we were vaccinating 1% of the population at a time. I think we've currently vaccinated nearly 2 million people. So, we're doing pretty well in our progress. The second phase of vaccination will be the under 50s, over 18s to under 50s. And the JCVI have said the fastest, most efficient way to do that is in age cohorts. So there's been a lot of discussion around occupational vaccination. That would be kinship carers, police being another one, teachers, folk like that, people who have an occupational risk. But the fastest way to do it, and there is still a bit of excess morbidity and mortality in the 40 to 50 group, the fastest way to get through the most of the population is to just do it in age cohorts and bang right through it. And I suppose one of the things to reassure people is we are getting through, we are coming for you. we are going to be vaccinating you all very, very soon. We think by mid-July, the entire population over 18 will have been vaccinated, which is just phenomenal. One of the things that I have to say, so one thing that I would have to be absolutely clear about is if you're caring for a child with, for whom you are, with medical needs, complex medical needs, who has a disability or who might be at risk of illness, then you can go into the unpaid carers category. So just now, as part of the over 50s cohort, the first cohort of JCVI, we're looking for unpaid carers are in JCVI 6 category, and there's a call at the moment for those people to register themselves. So if you're a kinship carer for a child with additional support needs because of a disability, long-term health problem, or a developmental condition, you will be eligible for vaccine as part of that group. And you need to register yourself. The self-registration process has just come out in the last few days. If anybody doesn't know about it or needs any extra support with it, my officials who are on this call will be happy to provide those details later so that you can advertise it. But so anybody who cares for a child who is at particular risk is able to register themselves just now. And everybody else who is under 50, which I'm in the under 50 group, we're coming for you really quick. I promise you. And you know, I'm a pharmacist by trade. I cannot believe how well the vaccine rollout is going. It just, you know, firstly, that we have a vaccine that works, that's so effective. Secondly, that we are managing the logistics of getting it out to everyone so fast. And the uptake has been really, really remarkable. So all of those things give us great hope that the future is going to be significantly brighter than it feels at the moment.
There's one final question. This is a COVID one as well. We've heard from some kinship carers about Kinship Care's COVID grant. Some carers are getting between £400 and £500. Why haven't all carers been given the same offer?
So again, I think this is a specific local authority initiative. So some local authorities have done that. They've just, you know, been holding their budgets just in the last few weeks. Some local authorities have chosen to make payments to kinship and foster families to improve the outcomes of the children who've been in their care. But unfortunately, that's not a universal thing. So not all 32 local authorities have done that. Scottish Government, I mean, contrary to popular belief, I can't dictate to local authorities what they do. And neither in some ways would it be appropriate. You know, when you think about, again, if I go back to those principles of local democracy, these are locally elected politicians who make decisions on what local priorities are. I mean, obviously, I understand the frustration that carers feel, that it's a bit of a postcode lottery, and if it were down to me and I did have the power to make local authorities I can't think where else I would advocate that the money be spent other than in my portfolio. This is where you get the you know, biggest difference to people's lives, is by supporting our youngest children. What I can say is the Scottish Government, as part of our winter support package, we did provide funding to organisations like Who Cares, Aberlour, you know, organisations like that, to support vulnerable families, including kinship families who are struggling because of the pandemic. And I would encourage any kinship family who is struggling to get in touch with those organisations. So Who Cares Scotland and Aberlour, and it's absolutely vital, as far as I'm concerned, that families get the support that they need. So if you're not getting support that you're needing from your local authority, those two organisations have been funded by the Scottish Government in order to make sure that your needs are met.
I'm very conscious of the time. We've got about 2 minutes left of our allotted 60 minutes. So, and that was actually the final formal question from the chat. I can see that quite a lot of the discussions have touched chords with folk. The issues, particularly where kinship carers don't have access to the same supports and financial support that other people have, just a constant source of that sense of people being overlooked is just reinforced by those issues, and the kind of the discussion around what happens in terms of your employment when you're taking on these things. I think several comments about that, so it'll be helpful if we can follow those things up following the event. I mean, a huge thank you to you, Minister, for joining us and making the time to take whatever questions people put in and came your way. I don't know whether, is there anything finally you wanted to say just in terms of the event and the week? And I suppose you've said it already, but just the amazing contribution that Kinship Cares have made over the last 10 months and what's been such a challenging time.
I mean, it has been an incredibly challenging time. And again, I just want to say thank you. You know, from me personally, from the Scottish Government and from Scotland, for the work that you do and for the difference that you make to some of the most vulnerable children in our communities. I wish I had a magic wand. And I tell you, I've wished I had a magic wand ever since I came into politics. So understanding the issues isn't enough. I promise you, we are working hard to resolve some of the issues that you've raised. It's not that we don't hear them or acknowledge that there are challenges. It's just finding the right balance and solving them. But we're determined to do that because we know just how important, you know, if I go back again to the situation, some of the situations that I've come across where children have landed up in kinship care arrangements in the midst of absolute crisis, you're there for them. And you take on these responsibilities without thinking about your own situation and your own need. You take on the responsibility of these vulnerable children. And I am determined that we will do better at supporting you all going forward.
Thanks again to everybody who's organised today and to the Minister in particular for coming along and for everybody who's contributed questions and comments during the day. That's been very, very helpful.
Absolute pleasure. And don't forget to try and get folk to sign up to the Kinship Care Collaborative. This is how we're going to make a difference going forward. Thank you.
Thank you, Minister.